The content of this podcast is for informational and entertainment purposes only. It is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the guidance of your healthcare provider with any questions you may have regarding your mental or physical health. The views expressed are those of the host and guests and do not replace personalized care from a licensed professional.
Welcome to Mindful Moments with Pedro Morante, a space where a nurse practitioner and educator shares real talk on mental wellness, mindfulness, and navigating life in and out of healthcare. Let's take a moment to breathe, reflect, and grow together.
Welcome to Mindful Moments. I'm your host, Pedro E. Morante. I'm a psychiatric mental health nurse practitioner board certified and also a family nurse practitioner board certified with doctorally prepared in nursing practice. So, would like to welcome a very important topic for today since it's July and it's also my birthday month. So, thank you so much for this highly prestigious guest of mine for today, very good friend of mine, Dr. Jonathan Llamas. He is a LinkedIn Top Nursing Voice 2024, Nurses Org's Nurse Icon, and Nurse Leader of the Year 2023, founder of Mind and Heart, and also a psychiatric nurse practitioner, board certified. Thank you so much, Dr. Jonathan.
Of course.
And
thank you so much for having me.
yes.
Yeah.
We've been planning this collaboration and finally it come into fruition for today. And
Exactly.
very important topic which we can really relate with and looking at the cultural lens of our clinical practice as psychiatric mental health nurse practitioner. Can you tell us about your background and also what brought you to being a nurse practitioner? And I've read a lot of your story and how you impact and also influence other nurses that are dreaming to become a nurse, which I'm really, really proud of you.
Well, thank you so much. Very, very touched by those kind words.
Yeah.
But, you know, I got into nursing starting from kind of like through the grace of God, I would say. It was one of those things I didn't really thought I would do, but obviously due to our Filipino background, we were very highly influenced by nurses in healthcare. And it was one of those things where I guess that's where God kind of led me to be. And obviously, you know my story in terms of the adversities I've had to face. I had to really learn a lot about myself. And I didn't really take nursing seriously when I first started since I was very young. But through those hardships and the failures, I was able to persevere and we were able to get to where I'm at today. So a little background is I received my BSN or my Bachelor's of Nursing in 2013. I worked as a nurse in the ICU setting as well as the mental health setting. And then during my couple of years working as a nurse, then I decided that I wanted to pursue higher education, which is the reason why in 2015, I decided to get my Doctor of Nursing Practice as well at Loma Linda. And then I was able to graduate in 2019. And then since then, obviously, there's been a lot going on in the world with the pandemic that has happened. And now the higher spotlight and need for mental health services. And so I think this is a great opportunity to talk a little bit more about what we do, as well as talking about minority mental health and what we can do to help shed some light on that as well.
Thank you so much, Dr. Jonathan. And I love how your nursing journey is, and also been following you in social media too, prior to us meeting in person too.
Yeah.
So I'm just inspired for those nurses that are out there to be the voice that they can and be the best version of themselves and be inspired by your story. So we'll talk about stigma, resilience, and also some cultural aspects of minority health, since July is Minority Mental Health, and our access to mental health among minorities kind of not so good according to the statistics by the National Institute for Mental Health.
Yeah.
So we'll talk about clinical experience and disparities in your practice right now and your perspective as a psychiatric mental health nurse practitioner. What mental health disparities do you commonly observe in minority communities?
That's a good question. I think the biggest thing that I'm seeing, especially in practice, is the fact that a lot of mental health issues are underdiagnosed and they're not really talked about, which delays treatment of care. So oftentimes for people who come from minority backgrounds, oftentimes they don't want to seek mental health because of the stigma surrounding it, and so oftentimes nothing is ever done unless it gets to the point where their mental health issues becomes a concern and crisis intervention is necessary. So it's the underdiagnosis, the underutilized treatment when it comes to mental health, especially in the minority population, is I think the most concerning.
Great. And according to statistics too, that we have a lot of like minorities that are suffering from cardiovascular issues and also diabetes, obesity, and stuff like that, where it's rooted for their mental health. They have like ineffective coping skills and stuff like that, overeating, lack of exercise, and also the fear of stigma and rejection.
True.
So my follow-up question is, how do social determinants of health, such as housing, education, and income, impact the mental health or well-being of our minority patients in our clinical practice?
I think social determinants of health is very underappreciated, to be honest with you. There's a lot of housing instability nowadays. There's a lot of food insecurity, and there's a lot of external factors that people oftentimes overlook that they don't realize is influencing their mental health, right? So if you don't have a place to live, if you don't know if you're going to be able to provide food on the table, if you are living in an area that has high risk of violence or stuff like that, it's going to affect how you feel. You're going to be more anxious. You might feel depressed or hopeless because you feel like you can't get out of that situation. And so social determinants of health, I think, is something that plays a huge role when it comes to minority mental health. But unfortunately, it's not something that's often talked about or even taught about in education. So I do think that is something that we need to shed some more light on and hopefully educate future practitioners on how to address it and hopefully help those who are living in situations where they deem are uncomfortable or just difficult.
I agree with you. I think a lot of health literacy and also a lot of social determinants can affect the access to care for our patients. And definitely it can impact our mental health care outcomes. The access to care, medications, and stuff like that, and insurance too could play a big role.
Yeah.
My follow-up question is, have you noticed any patterns of misdiagnosis or underdiagnosis of mental health disorders in minority populations? If so, what do you think contributes to that?
That is something that we see often as well. Again, just obviously speaking based off of our Filipino heritage and just kind of like the Asian population, I'm seeing in practice anyway that oftentimes when people explain their symptoms, it is oftentimes miscommunicated. So for example, for the Asian population, especially like the female Asian population, when they're explaining how they feel, oftentimes it shows up as somatic complaints, right, or physiological complaints. So they might have more increased GI symptoms. They might feel more queasy, or they have headaches, or have lethargy, fatigue. But those are subtle cues of depression, right? But oftentimes, if you are a provider and you're unaware of these type of subtle cues, you might be misdiagnosed or underdiagnosed, and you might not realize that the symptoms that they're describing is actually subtle signs of depression, as opposed to something obvious, right? As like maybe she just has GI upset, or maybe she just has a headache, for whatever case. So that is something that we need to, again, work on. There was an interesting study that I read in 2019 from the Psychiatric Services, where African American population, they're being overdiagnosed with schizophrenia when a lot of their symptoms are actually more aligned with mood disorders, and a lot of it, again, is based on our implicit bias. Unfortunately, sometimes there's a lot of stereotypes that people subconsciously have that they're not aware of, and that can get in the way in misdiagnosing and misevaluating symptoms.
Great. I kind of like how you explain it thoroughly in terms of the misdiagnosis part. And there's a lot of studies that a lot of like African American or Black are usually misdiagnosed also being aggressive, but actually when you rule out their history, they have some issues of like trauma or even violence at home, which a lot of providers are not dwelling into it. So
True.
we kind of like need to look at trauma history, childhood history, and how they are when they're growing up.
And that's why I do agree that there has to be some sense of like cultural humility, right? And understand that every culture is different, and the best way that we can do it, we don't have to be experts in terms of every person's culture. We just have to be respectful and open and willing to like listen and understand, because again, like you said, like that is a big deal where we're overdiagnosing just because of their culture or how we perceive it to be, when in reality we're overlooking a lot of the subtle signs, right, that could be more aligned with like a mood disorder, or like, you know, the anger and irritability is something due to trauma or whatever the case may be.
Great. And there was like also connotation that if you're an Asian, they're less likely to express their pain to, especially labor and delivery department, wherein oh, she's Asian, she can handle pain well, she doesn't need any pain medication. So there's like some stereotypes that is going on among the minority, which creates a barrier for care. Now let's go to cultural competence and practice. This department, basically, I'm gonna ask you, how do cultural beliefs or stigma influence how minority patients understand and engage in mental health care?
So, again, I'm Filipino, right? So obviously, as a Filipino American, I can only speak on my experience. But I think one of the biggest thing that I've observed and witnessed growing up is, again, the stigma surrounding mental health. Oftentimes, when it comes to at least the Filipino community, what I've observed is that mental health typically is seen as either a personal weakness or family failure, or it's a sense of shame when it comes to when they see someone going through depression. It's a big deal for them, and oftentimes they personalize it, right? And so if someone is going through something like depression or anxiety, because of the fact that they don't want to disappoint their families, they don't want to have a sense of shame, they kind of just suppress it and then just keep it down to the point where it gets progressively worse, and then, you know, crisis intervention is needed. And so we have to do a better job in educating, you know, our minority health populations that, you know, if someone has high blood sugar, right, or diabetes, we're just not going to just overlook that, right? We want to encourage them to seek help. So same thing when it comes to mental health issues. Like if you're starting to notice these type of symptoms of depression, anxiety, mood disorder, emotional dysregulation, that it's important that we address it right away, because oftentimes it's not on them personally. It's not a personal weakness, but there's a lot of factors that go into it. And so we just have to destigmatize it and make them realize that this something is treatable, but we have to find strength in our vulnerability.
Great. And I also agree with you, like a lot of cultures, they find it like demasculating, or they find it like to be destigmatized from their family members, that even providers, that if they know that there's somebody in your family that has mental health issues and concerns, they'll be like, some of the providers will be like not admitting it because they think that it's a sign of weakness, shame, or there's attached to it like looking down on their family members as per se. So we need to be culturally informed as per se, not just being competent about different cultural backgrounds too.
Yeah.
Okay, thank you. My follow-up question to you, what strategies do you use to ensure culturally sensitive care when treating patients from diverse backgrounds?
So my DMP project, when I was in school pursuing my doctorate degree, was based off the low-line model. I don't know if you're familiar with that, but it's a way to de-escalate patients who become aggressive. And one of the things that I've learned through that low-line model is active listening, right? And I think, again, when it comes to cultural humility, one of the strategies that I've continued to apply, especially now working as a psychiatric nurse practitioner, is the willingness to, again, be respectful, but also understand that we have to be more curious, right? As opposed to creating assumptions on other people. So I think coming from that curiosity standpoint, you ask more valid, more thorough questions. You start to ask about family dynamics. You start to ask about spiritual practices. You start to ask about just kind of like the relationship issues and stuff like that. And all those things, again, play a big role in terms of mental health. So if we come from a place of curiosity rather than assumptions, I think that's a great start. And you'll realize that patients will be a little bit more open and transparent when it comes to kind of feeling that this is a safe space for them to open up.
I agree. I think if you make the patients feel heard, feel safe and validated with their feelings, they can slowly open up to you as a provider, and creating a therapeutic alliance wherein you and the patient support each other in terms of the mutual goals will be will be beneficial for the relationship.
Very true.
Thank you for that. And how do you adapt your communication when there are language or cultural barriers with your patients?
That's a good question, and again, that's something I do feel that is oftentimes not addressed. We have to understand that language plays a big role in communication, right? So, if we do not feel comfortable, or if we feel like we don't understand the patient fully, we have to first and foremost be humble enough to accept that. So if someone is speaking to me but is purely a Spanish speaker, they have broken English, and if I don't feel comfortable obviously being able to provide the highest quality of care, then I'm going to have to refer, right? So trying to make sure that they are set up and connected with the right people who I do feel would be aligned with their culture, hopefully someone who's able to speak the language much more effectively than I am, right? Because the worst thing that you can do as a provider is pretend that I can do this, or I can pretty much just kind of like work with this. But if we're not really listening, or we're not really fully understanding what the patient is describing, then we may have a higher risk of misdiagnosing, right? We might make mistakes in terms of like understanding fully what the patient is trying to explain. So it's important for us to, again, ask ourselves, are we comfortable with seeing this population? And if not, then it's okay for us to refer to hopefully other providers who will be able to do a better job in aligning and understanding and conveying the type of care that they need, basically.
I agree with you, and that's very important. Communication between you and the patient plays a big role. And also some patients will be like hesitant to ask questions, right? Especially if you're perceived as Asian, you'll be like, if you ask them like, do you have any questions? They kind of like perceive it like, do you have any problems, something like that. So I think as a provider, we kind of like circumnavigate what questions we'll ask our patients to make them feel that we're not judging their questions or challenging them or defying their questions, or, especially when terms about compliance, like access to their medication and insurance will be a big problem. Like, for example, they're not taking their medication. So if you ask them, like, have you been taking your medications lately? I think there's a better way to ask, like, okay, it seems like you still have some medication left. Is it a barrier? Are you saving those medications because of the side effects, or because you don't have the capability to pay your copay or stuff like that? So we really need to dive deeper for that.
I agree.
Okay. Thank you. Now we talk about cultural competence, clinical experience. Now we go with trust and access to care, and this is very important. Minority communities often report mistrust of the healthcare system. How do you build trust with these patients?
So for me, trust is established when you treat patients as human beings. I feel that oftentimes it's unfortunate that, especially in today's healthcare, there's a lot of patients, and you'd be surprised actually, there's a lot of patients who come up to me and they tell me this is the first time I actually feel comfortable speaking with a provider. And it's something as easy as asking them what their name is and what they prefer to be called, or just trying to respect just little things like that, because it shows that we're going the extra mile to really want to see them for who they are, not just their symptoms. And so if we're establishing the person and we're not just treating the diagnosis and the symptoms, then patients feel more at ease and they'll be more open and transparent, and that will help provide more clarity, and we'll be able to provide the highest effective form of treatment that we can for the patients. But I think the most important thing is, again, trying to treat the human behind the condition.
I agree with you, and definitely the trust needs to be worked on, and also as a provider, we have to really create that therapeutic alliance rather than therapeutic rupture. So simple as you tell your patient you're going to be on vacation for 30 days. You need to come back after 30 days or inform them, or else they're going to have like a sense of mistrust too. Okay. And then people of color too sometimes could tend to lean over same ethnicity or providers, and it must be a match between their goals and yours.
Exactly. Exactly.
My follow-up question is, what systemic or institutional barriers have you seen that limit access to mental health care for minority populations?
So barriers, I think, that limits access is distance, right? Again, oftentimes people who are living in underserved populations, or they're living in an area where they may not have access to the highest quality of care, it limits their ability to receive the best treatment. So, I mean, the great thing about nurse practitioners is that oftentimes we are working at the grassroots level, right? So you're seeing more nurse practitioners in underserved areas. You see them more in like rural clinics. Obviously, the telehealth and telemedicine platforms have been instrumental, in my opinion, in terms of increasing our access to care for patients, right, who may not have had access elsewhere. And so it's important for us to do what we can and be the bridge. And a lot of it is just trying to also incorporate ourselves, right? If we, for example, for the Filipino community, we're very faith-based oriented, right? And so maybe if it's working at your, church, like just letting them know, like you are a provider and that this is something that you do, just increasing your outreach that way, I think would be helpful, because oftentimes, right, a lot of our population or the people who may need help, they seek it in different ways, whether it's spirituality or other things like that. So those are the type of things that I always try to, educate future nurse practitioners as well as future educators, that there's other ways that we can provide meaningful care outside of the typical hospital system.
That's very important insights that we've shared, and basically a lot of our next generation providers should be at least aware of this issues and concerns. And in your experience, how has the shortage of minority mental health providers affected our patients?
The shortage of nurse practitioners and
Yes.
everything. I think for me, it's more so the shortage of minority providers in terms of providing a sense of like relatability. The best way I can describe it is, again, like if, for me working as a provider, and then I have patients who are considered themselves as Asian or Filipino or even the Hispanic, Latino populations, there's a sense of relatability there, and there's a shared cultural understanding, even if, let's say, I'm not exactly, Chinese or Japanese or Hispanic, but we kind of sort of understand the culture behind it. And just that helps, again, increase the willingness to kind of open up and talk about certain things that they may have necessarily not felt comfortable talking about for a provider that may not have understanding of the culture behind itself. And so I do feel like we need more of a increase of providers who have that understanding. They may not have to be Asian too. They just have to be willing to learn, right? And so that's why I do agree, like whether it's cultural sensitivity training, whether it's just learning to be open and understanding to these different cultures. I mean, that's going to make a huge difference in care.
I agree with you. I think culturally informed care is very important, and being culturally sensitive and competent is really important for us as starting providers too, for those who are new grads, that they really need to have a training on it so that they can better hone their skills, not only with their prescription skills, but also a sense of communication styles, and also considering their cultural issues and concerns.
Yeah, and that's the thing is still, in my opinion, underutilized in education. So that's what I hope that more schools and more places are at least implementing that, because we're starting to see it more and more, especially in practice.
Yes, and creates an impact on the mental health care outcomes of our
Correct.
patients if we don't utilize that. Our next section will be the provider bias and advocacy. How do you recognize and address implicit bias in your clinical practice when working with your diverse patients?
That's something that we all struggle with, right? I think it's fair to say that everyone has some sort of bias when it comes to other cultures, but that's something that we have to be humble enough to admit. And especially us as providers, we have to be willing enough and humble enough to understand, okay, these are my biases, but I cannot allow that to interfere with my ability to treat this individual and this person the best way and as objectively as possible, right? And so I think we talked about initially, right, in terms of the African American community, how oftentimes they are being overly diagnosed as whether they're paranoid or psychotic because of how they are appearing to seem, when in reality that it doesn't align with the diagnostic statistic manual when it comes to symptomatology, right? Also with like, again, when I talked about the Asian population, especially the female Asian population, where they typically, when they talk about their symptoms, it's more somatic based, and we have to be again be more open in regards to the cultural significance when it comes to that. So again, it comes from cultural humility. I think it's just willingness to understand that is something that we have to be aware of, and we cannot allow that to interfere with our judgment, especially when we're coming to evaluate the patients.
I agree with you. There's so much stereotyping going
Exactly.
on, and also like incompetence in terms of knowing the cultures of the patient. So diving deeper also about their history and looking at how their upbringing and how they are, and the communication. If they're not able to connect well with the providers, then probably it's a time for you to refer them out, right?
Yeah, and I think one of the, again, I'm just speaking because of experience, but one of the things that I've seen is maybe preventing providers to take the extra step in trying to do that is the factors that overabundance and just kind of like the increased amount of paperwork that limits our ability to really spend time with these patients and really get to know them on a more personal level. I think that's what's hindering our ability to provide that access of care. Obviously, again, since something that I'm aware of that makes a huge difference, I do prioritize that. But again, I understand that maybe in other situations, in other clinics or whatever setting that they're working, that is something that is a barrier I've seen, or an obstacle that's preventing them to maybe dig a little bit deeper.
It's true, and provider burnout too can happen when exactly feels like you're running out of time, or you have some productivity reports that you have to meet and stuff like that. So I think we could do better as a provider, and also the healthcare system can improve on the way that the system is.
I agree.
Okay. In what ways can a nurse practitioner act as an advocate for health equity and better mental health access for underserved communities?
I think, again, that comes from our willingness to not be afraid to work in the grassroots level, right? I think nurse practitioners at the core were nurses, right? So we were taught and educated on being a patient advocate first and foremost, making sure that we are speaking and speaking up for our patients who may not have a voice for themselves, right? And I think that's a very powerful thing, especially because of the fact that nurses are the ones who typically spend the most time with the patients and everything. So advocacy comes in different forms, whether it's, again, at the grassroots level, through education, through things like this, which is kind of like social media or podcasting, or even at the legislative level, wherever you seem to be or you're called to do, there's always a way for us to kind of advocate, right? So it's always one of those things that I always try to encourage the people that follow me on social media, is that you have a voice, even if you feel like the voice that you have or the impact that you have is minimal. Even impacting one person that day is huge, because you never know how that's going to have a ripple out effect, right?
Great. And also I would like to add that we can also be a member of different organizations that are
true.
available out there. You have your AANP, your ANCC, ANA. You also have your Doctors of Color, California Nurse Practitioner, different sub-chapters, Philippine Nurse Association too, which we could, and also you just need to network and find ways on how to reach your message to your bigger audience. And I think as a nurse practitioner, we have that capability also to reach a lot of people across, not only in the US, but also globally.
Yeah, I agree.
Right. So let's talk about innovation and policy. This is one of my favorite topic. Have you been involved in any community-based or policy initiatives aimed at improving mental health outcomes for minorities?
Not yet, but that is something that I'd be open to doing. I think there's been a lot of buzz when it comes to AI, right? And AI is becoming more and more prevalent in our society today. So I do believe that there's ways that we can utilize AI to hopefully positively impact minority health and minority communities. But it's one of those things that you have to be willing, and you have to be willing to be flexible and accept change. A lot of times you're seeing providers who are resistant to change, but as you know, when it comes to healthcare and transformative care, we have to be open to that. So personally, right now, I'm not involved in anything in regards to certain policies or advanced breakthroughs yet. But again, it's one of those things where I'm keeping an eye on and trying to see what I can do to help contribute to the movement, to hopefully continue to help others who, again, have a hard time seeking help for themselves.
And exciting, probably a lot of protocols or things that we can do is particularly focus also on substance use disorder and particularly addiction issues, which is very big right now. So we could definitely create programs that could be more innovative, especially for MAT or medication-assisted treatment.
Is there anything that you particularly are excited about or that you're in regards to innovation?
Yeah, I think it's all about precision psychiatry, wherein we kind of like create a protocols how we can best serve this population, especially to prevent them from having relapse or even going to the hospital again.
Yeah.
Okay. And can you share a story that illustrates both the challenges and strengths of minority mental health resilience?
As a patient or as a provider like myself?
As a provider and as a patient, so we can do either or.
So for me, when it comes to, again, resilience, a lot of the resilience or people who's able to persevere through hardships, a lot of it is based on, again, first and foremost, their upbringing, I think, and first and foremost, like how they perceive themselves and how they view themselves. So there's a lot of things when it comes to that. So like, for example, for me anyway, when it comes to my story and having to persevere and overcome the adversity that I had to go through, right? Failing out of nursing school, being told that you are not going to amount to anything, right? Being like people assuming that, you're not going to be successful, right? There's a lot of it I could have easily accepted and took on as part of my own personality and just agree that that is who I'm going to be, that I'm not going to amount to anything. But again, I attribute it a lot to my faith and my upbringing. I've been very grateful because my parents, especially my mom, was the one who really instilled the importance of prayer and having that spiritual backbone and having God as the center of kind of like my purpose. And so leaning onto that, especially the faith-based aspect of things, that gave me the strength to keep moving forward and persevering, right? But for everyone, it could be different. Other people, they may not have the same spiritual belief as me, but they may have maybe a person such as their parents or their child that they use as a sense of motivation so that they can improve their livelihood, not just for themselves, but the people that they care about, right? So those are some of the things that I think about. Is there anything that you think about when it comes to resilience and overcoming that too?
I think we're Filipino Americans. Usually Filipinos are known to be strong in terms of their upbringing for family values and support system. We always are supported by our family, and I think our faith also is important with our culture, which brings us to being mentally competent in terms of awareness.
I agree.
But sometimes we can overlook that some patients may not be like that, and right, they may not come from a good support system or may not have a good family background, or violence may be present.
I agree.
And that could be something that is not overlooked.
I agree. And that's why for me, that's why it's important for us to continue to be curious and ask about these things that, again, not a lot of providers tend to ask, right? When it comes to spiritual practices or kind of like the generational trauma that's been passed down. Because again, I mean, if their parents and their grandparents, they're not very familiar with mental health, right? And they're just observing and replicating the behaviors that they've seen from the people around them, you can't really blame them for reacting the way that they do. But now, as people who are in this generation now, who's been more educated in regards to mental health and understanding that a lot of it is influenced by a lot of different things, then it's up to us to kind of break that generational trauma, right? It's up to us now to choose to not continue that type of trauma or behavior onto the generations who's going to come after us, basically.
And follow-up question, if you could change one thing in the mental health care system right now to better serve minority populations, what would it be and why?
I think if there's one thing that I can change, again, a lot of it is access. We need to make sure that we increase funding to mental health clinics that need it, especially for for patients who are living in the rural underserved populations. I do feel like there needs to be more of a financial incentive, especially for minority populations to hopefully pursue a career in healthcare, whether it's scholarships or paying back tuition reimbursement, something of the like, where it incentivizes people that to pursue a career to help others, so that they can provide that sense of relatability and trust, especially for having that representation, right? Because I do feel like again, patients seem to be more receptive when they see someone like them, and again, we have that shared cultural understanding, and that gives them a sense of ease. So I think that is something that I would like to see, and also in terms of again, more educational opportunities when it comes to what we talked about, right? In terms of cultural humility, cultural expressions, the differences between different cultures, and being open and understanding in regards to that, as well as the social determinants of health, like you talked about. These are things that I think is underutilized and undereducated in the school system. So hopefully we can address all these things, but obviously if we can address just one, or even just starting addressing one, I think that's a good step in the right direction.
Right, and we have given so much examples about being on minority, that we have access to care that is limited. We just need to educate more patients that there is help, and it's not a sign of weakness to seek help, actually, because some of them wait until the end, until they experience crisis, and that's wherein complications, problems further is not mitigated early in the process, is that they have more mental health crisis that is unmanaged. Like a patient of color could present into the clinic being having anxiety, but some providers could perceive that they could be very aggressive, right? So there could be a disconnect in terms of a clear understanding of their symptoms, and also their upbringing could be violence, trauma in the past that we are missing out here. So we can either give them therapy and medications and combination, and a lot of self-care.
Yeah, I agree.
And if you could talk to yourself 5 years or 10 years from your nursing journey, I know you have gone some rejections and stuff like that. What will be your best advice for those who have also encountered rejections from nursing programs, or anybody that they think they don't have a voice, or even cannot make it as a nurse, or even a nurse practitioner, or a doctorally prepared nurse practitioner, and they have like a fear of imposter syndrome?
Yeah.
What will be your advice for the audience that are listening right now?
Just keep going. Just keep going. It's very easy for us to get discouraged. I think a lot of people easily get discouraged. We live in a society, unfortunately, nowadays where everything needs to be fast, right? And I think we also live in a society where we oftentimes compare our lives with the people around us. We feel that we're behind, or we're not successful enough, or we're not doing enough. And I think that is the biggest lie that a lot of people believe, myself included sometimes. You can't help it because we're so, again, inundated with so many different things. We're so connected nowadays with social media that we see so many things all at once that we can't help but question ourselves if we are on the right track. But if we just silence the noise and you just kind of focus and understand that everyone's path is going to be different, and success is different based on not just, maybe success is not something that you can say where, oh, I have to be better than this person for me to be successful, right? You can be successful by being different, right? You don't have to follow the status quo. And so I tell people, if you're going through something like difficult, or if you're going through something where you feel like you want to give up, just keep going, right? Every day that is given to you is an opportunity for you to redefine yourself, right? If you find something that you don't like about who you are, it doesn't mean that you have to stay the way you are. That's the beautiful thing about being in this country. That's the beautiful thing about being able to have the technologies that we have now, because it doesn't matter where you are, where you're from. Anyone can be successful nowadays, but we have to be willing to keep going, and we have to be willing to understand that your pathways to success is not going to be the same as maybe the other people that you see, and that's okay.
Thank you. And that's important to listen to what you're saying, that sometimes each path is different, right?
Yes.
And success is very subjective sometimes that we tend to compare ourselves to, and we tend to self-sabotage too, like, oh, I'm not doing well, he's doing well. So, and also a lot of minorities, they tend to post everything about their life sometimes that they don't talk about their mental health. Like,
Of
okay,
course.
I went to this place, I'm buying this property, but when it comes to mental health, we're kind of like shy away from it.
Yeah.
What will be your message for those who are afraid to seek mental health, and also what will be your message for them that mental health is still still a stigma on it, and what will be your advice for those patients that are afraid to go and seek for mental health, especially in people of color and minority?
Yeah. Well, what I would say to that is that there's a lot of strength in vulnerability. I think you touched on it a little bit, right? Where people are afraid to be vulnerable because they were taught by their parents or the people around them that being vulnerable is a sign of weakness, which is entirely not true. And I think that that's something that we have to reframe, especially as providers in this space. We have to do a better job in understanding that we are who we are based off of the things that we tell ourselves in our head, right? So the internal dialogue that we say to ourselves in our head, whether it's positive things or negative things, I mean, that's who we end up becoming. So if for people who are struggling with mental health, just know that you're not alone, right? That there are people out there who's wanting and willing to help you. But the first step is understanding that I can't do this alone, and that's okay, right? Because sometimes there's a lot of, whether it's pride or insecurity or fear of being judged that prevents us from seeking the treatment that they help. But if we continue to succumb to those thoughts, then it prevents us from reaching our full potential, right? And there's a lot of people that don't realize that the thing that's blocking their ability to reach their full potential is themselves at the end of the day. So I would like to encourage them, again, that now is the time, right? Now is the time. If there's something that you don't like about yourself, there's something that you feel like you need to get off your chest or just kind of like talk about, again, there's so many providers out there who's willing to help. And again, just knowing that you're not alone, especially in today's age, I think that's very comforting,
Yes, there's a lot of like anxiety, depression, and PTSD going on.
Yeah.
So just need to make sure that our message as a provider is heard by our minority patients, making sure that we are here for you. And
Exactly.
in case of mental health crisis hotline number is available to 988, and you have some support system that you guys can utilize, and we're always here for you.
True.
And mental health is always important. We need to prioritize it, because without a mental health, there's no true health.
Exactly.
So we need to make sure we always need to ask for help, do an early intervention other than waiting when you're already in a crisis mode.
Yeah, I agree.
Dr. Jonathan, what will be your 5 years or 10 years plan, and if you can tell the audience to where they can follow you for your social media?
Sure. Well, to answer the second question, if anyone is interested, you can find me on Instagram at Dr. Jonathan V. Llamas. You can also find me on LinkedIn as well at Jonathan V. Llamas, if you want to follow me on there. In regards to my 5-10-year plan, it's hard to say, but I like to temper my expectations. So I hope by that time I continue to make a difference in the lives of my patients. I think that's is something that's very noble. I think oftentimes people, when they're given that question, they assume like they have to continue to reach for the stars or else they're not going to be successful. But I think for me anyway, success is continuing to make a positive impact regardless of how small it may seem, because you're a difference maker, right? So hopefully, whether it's in the continuing the patient space, helping my future patients continue to get better, whether it's through the education space or social media space, which I'm already doing right now. It's one of those things where we can improve ourselves little by little, and I think those little things adds up a long way.
Thank you. I'm really proud of you, and also
Thank
all your
you.
achievements, and also as a friend of yours, I'm always rooting for you that
Likewise.
can create an impact, baby steps, but also reaching audience. And also a lot of our minority populations are actually are afraid to reach out or also message us directly if you have any questions. I think that will be an important steps for them
agree.
too. Okay. Thank you so much, Dr.
Thank
Jonathan
you.
Llamas.
Thank you,
And I'm
Dr.
so honored to be your host for today's podcast. We will do more of this. I really, really appreciate your time and effort for today. And also, you'll be married this year too, right?
Yes.
Behind every man is a successful woman. Would you like to create a shout out or message to Anne?
Yeah,
Who's been very supportive of you too.
Of course. Well, I want to thank you for bringing up my fiance Anne, but thank you so much for obviously being such a strong support person for me and for obviously loving me unconditionally and just cheering me on every step of the way. Obviously thanking my parents as well as my family members. I wouldn't be here without my family. And it's one of those things, obviously, as Filipinos, right? And especially for many of us who come from minority backgrounds, we understand that family is a big part of who we are. So thank you for allowing me to shout out that as well. And I'm sure you have any shout outs to your kids and your lovely
wife and my twins, my family. Thank you. So there you go. If you have any questions for us, please feel free to message Dr. Llamas or me, and we're here for you. Always remember you are not alone with your mental health journey. And always remember that we are here for you. And thank you for making mental health as a priority.
Thank you.
See you again in the next episode, Dr. Jonathan. Yay.
Bye, guys.
Thanks for listening to Mindful Moments with Pedro Morante. Be sure to follow the podcast so you'll never miss an episode. If you find value in our time together, leave a quick review. It helps more people discover the space we're creating. For updates and more reflections, follow us on social media. Until next time, take care.